we are in the pre-op room. We're going to get you ready for your surgery. So what we're going to do is we're going to go do a little timeout. I'm going to ask you your name, your date of birth, what we're doing today. And that's just so we all are aware and are all on the same page of what we're doing. We're going to get your blood pressure, your temperature. We are also going to start your IV. Meanwhile, we'll also get you dressed. And then you'll see Dr. Epstein here shortly. You'll also see the anesthesiologist. You can ask them any questions you have. And then we'll go over some of the discharge instructions too while we're waiting for the doctors, just so you're fully prepared for how to care for the surgery afterwards.
All right, here we have our patient of the day, Amy. And Amy is going to have really a complete facial rejuvenation today in the form of a facelift, which includes her neck lift. And you can see she's got some little bit of extra fatty tissue here. She's starting to develop a jowl, and I'm going to have you turn to the side here, a little bit of loss of definition of her jawline. And you can kind of see how this whole cheek unit has dropped down. And we're gonna kind of reposition that cheek in an upward position on both sides. And when we do that from both sides, it's really going to take care of the neck, sharpen the jawline. It's going to blunt the marionette line, the nasolabial fold. The other thing it's going to do is it's going to help some of this little hollowing here. We call this a tear trough deformity, and which leads me to the other two procedures that we're going to do. We're going to treat her lower lids, and lower lids are interesting in that really not everybody presents in the exact same fashion. In Amy's case, she has some bulging fat. You can kind of see it. If I have you close one eye here for a second and push, you can see it really bulges out quite a bit. She's got the hollow below there. Her skin quality is pretty good, but when we remove or displace some of that fat, it's going to get a little bit lax. So we're going to treat that with a light, like a TCA peel, actually. 35%, it's not so light, but it'll really help tighten up the skin. She's got, you can open up, looking straight ahead there for a second, really got an excellent snapback test, so she's got good support to her lid. She's really a good candidate for this. Now, a lot of people, when they have extra skin of the lower lid, or extra fat or bulging fat, we just go in and take it out. But what we're going to do in this case is we're going to mobilize that fat and kind of push it into this area where she's missing some volume. So it's really, we call it fat displacement in this particular case. And we're going to do all of that work from the inside. When she's sleeping, we'll put a protective lens over her eye. I'll be able to my assistant will help me, we'll pull this lid down, and I'll make a small incision on the inside of the lid, and the fat's sitting right there. And we'll displace that down. Her uppers, that's the easiest part of this whole procedure. She's got a little extra fatty tissue, and mostly a lot of extra skin. And so we're going to take care of that. Now, some people come in, when they come in complaining of heaviness of their upper lids. They think, oh, my forehead's dropping, or they don't know what it is exactly. And sometimes it can be, but clearly in Amy's case, her forehead is not dropped at all, and her brow is in a nice elevated position. If I were to do a forehead lift on her, it would really look funny. So she's got the benefit of having a really nice high arch of her brow, sits well above her orbit. We want to leave that alone. We just want to treat the upper lid skin. So that's what our game plan is today. Before we enter the room, I'm going to go ahead and mark her out for the facelift, which includes the neck lift and the upper and lower lids. I kind of have the foolproof way of marking these so we never take too much skin. So it's really important so she can close her eye when we're done. I'll go ahead and actually I'm going to have you close your eye. And this bottom incision line is going to be right in the natural crease right here. And I'm just going to push in your eye here for a second. And what that does is sort of sets the Sets the mark so it doesn't smudge when she opens up her eye. So we're starting to mark the neck and facelift procedure. You come behind the ear and actually make the incision right up on top here, just in the skin. So when it gets pulled down, it'll land right in the crease that way. So there's two different ways to do this incision around the ear. Some people go behind this little tragus here and they think they're being cute by trying to hide the incision. I am a big believer that actually makes the facelift scar even more noticeable, because it actually pulls this little tragus forward. There's too much, that skin on that area there is supposed to be really thin, and it gets to be thick. So, and the scar in front of the ear heals up so incredibly well that it just doesn't make any sense to do that. Now here, I'm going to go up a little bit thinner here. You won't even see this because your hair's going to cover, and she's got wears a nice short haircut. It'll be easier on us. I'm just going to hold right close to that. Sometimes, depending on how much skin, we may go in front of the, in front here, but I think I'll be able to get this out and not raise her hairline too much without, making it look abnormal. What I've marked here, we marked the midline of her neck. She's just going to have a little tiny incision right underneath here, just so I can do a little liposuction underneath the chin. And these represent where I'm going to put my lifting sutures underneath, where it's the soft tissue that actually gets lifted and supported and reshaped. And then when I do that, the skin is going to follow nicely, and we just clip off some of the extra skin and sew it in place. So she's going to get a terrific result. It's going to be a nice rejuvenation.